Hello my dear students, today we are going to study another blood disorder, that is anemia. Okay. So what is anemia? Definition is anemia is condition in which hemoglobin concentration is lower than normal. Okay. So here mainly we say anemia, people, mainly women always suffer with anemia. Anemia is nothing but when hemoglobin is less than normal, which we say it should be, if it is less than 12.5, then we say the person is anemic, and that is different range for women, and that is females and males. It reflects the presence of fewer than normal number of erythrocytes. So here what is less is the RBCs, red blood cells. Okay, so RBCs are less. Okay, and because of less RBCs there is less hemoglobin in the blood. As a result, the amount of oxygen delivered to the body tissue is also diminished, but it will depend upon how much is the RBCs. If it is very less, then the oxygen delivered to the tissues will be lesser. Okay, so what is anemia? Anemia is nothing but when hemoglobin concentration is less than normal, and along with that what we see is the RBCs are very less in the blood. Now you can see over here the difference. Now first let us see this red blood cells which are there. You can see how much, very nice. In normal you can see very nice number of red blood cells, but here you see very less. Okay, and here can you see the changes in the color? Ideally a person who's anemic, now typically you can see in the palm. Okay, the palm becomes pale. It's not as bright color, it's pale enough. You can also see in your lower conjunctiva it will be pale, the face will be pale if a person is anemic. Okay, so there are different classification of anemia. Now here I am going to teach you anemia itself. Okay, because there are many types of anemia: iron deficiency anemia, thalassemia, sickle cell anemia. The further divisions I will be taking it later, but here because commonly the question if is asked is just anemia, so what you're going to write? So in general what you need to write whenever anemia only is asked for you, I have brought for you that. So you're going to mention the classification of anemia. So how is this RBC is going down? How it is that this hemoglobin is less? So first classification tells us about it. The first classification is hypoproliferative anemia. The bone marrow does not produce. Okay, ideally a bone marrow produces, right? So bone marrow does not produce adequate number of erythrocytes. Erythrocytes are nothing but RBCs, red blood cells. Okay, inadequate production of RBCs or erythrocytes may result from marrow damage due to medications. So ideally what we are saying is that hypoproliferative, that means there is a less amount of this RBCs which are being produced. Now this less amount of RBCs which are being produced by the bone marrow can be because of damage to the bone marrow. How the bone marrow can be damaged? Because of some medications. So medications are chloramine phenol can be there. Next is chemicals, any chemicals which can lead into like benzene, or from lack of factors. Commonly seen this, that is there is less amount of iron which a person is taking, less amount of folic acid, less amount of vitamin B12 is taken by the patient. It can lead, these are the most common factors which are seen that this is lacking, and that's why there is less amount of RBCs in the patient. Folic acid, erythropoietin necessary for erythrocyte, that is RBCs formation. Okay, so you can see that most commonly hypoproliferative anemia, that is the production of your RBCs are less in the bone marrow, mainly because of this lacking of this particular factors which are essential, which are very much required for the formation of your RBCs. So what are they? Iron is there, that's why we have iron deficiency anemia, we have folic acid deficiency anemia. There's a different, we will be seeing about it, but most common reason is because of this factor. So first classification was hypoproliferative anemia. Understood? Next classification is hemolytic. What do you mean by lysis? That is breaking down. Okay, hemolysis means there is breaking down, or what do you say, the RBCs are breakdown is there. RBC is further destroyed or getting destroyed. Okay, so hemolytic anemia, premature destruction of your erythrocytes, that is nothing but RBCs, results in liberation of hemoglobin from the erythrocytes into the plasma. So here there is no there is no problem in the formation of RBC. Nicely, many RBCs are formed from the bone marrow. Nice factors are present in the body. That's why good amount of RBCs are formed. But after formation, what is happening is the RBCs are destroyed, or there is destruction of the RBCs. Understood? Okay, so results in liberation. Because of this destruction, what happens is hemoglobin is been released from the erythrocyte into the plasma, and the released hemoglobin is converted into large part to bilirubin. Okay, and therefore the bilirubin concentration rises in the body. So what is important over here to understand is in the diagnostic factor or the diagnostic finding, when we study, if the patient's bilirubin is high, then we can understand that there is a chance that the RBCs are produced properly, but there's a destruction of RBCs. Because of the destruction of RBCs, hemoglobin is been coming out of the RBCs, right? This hemoglobin is further converted into large part of bilirubin, and thus bilirubin rises in our body. Okay, so destruction of this red blood cells can result from what all things? The first is from an abnormality within the erythrocytes itself, that is sickle cell disease or sickle cell anemia, which we say. In this, ideally, just an example, our erythrocytes are like this, right? In sickle cell, it is like this, like a half moon shaped almost. Okay, so what happens is that there is no an adequate amount of this particular RBCs which are there in order to hold back your hemoglobin. Okay, next is this deficiencies. Okay, if there is G6PD, that is glucose 6 phosphate dehydrogenase, this is nothing but an enzyme. If there's a deficiency of this enzyme, then it can lead to destruction of RBCs. Okay, next is some problem within the plasma. Now what we studied is that in the second classification, that there is destruction, that is my RBCs are breaking down. Now this RBC can break down if there is some problem in the erythrocytes itself, that is in the RBCs itself. Second is the problem within the plasma. As you know, our blood, like plasma is there, serum is there. In plasma we have this RBCs and all. So in the plasma, if there is any problem, so what can be the problem? Immune hemolytic anemias, okay, where autoimmune disorders if are there, where this plasma is breaking down its own RBCs. Okay, next is from direct injury to the erythrocyte within the circulation, that is hemolysis caused by mechanical heart valve. Now what is mechanical heart valve? Is nothing but some prosthetic heart valve is not functioning. If you know your heart valves, we have AV valves, that is atrioventricular valves, and we have semilunar valves, that is aortic and pulmonic valve. AV valves are mitral and tricuspid valve. If there is some problem in this valve, that is either regurgitation or stenosis, what happens is that there won't be adequate cardiac output. In order to maintain the cardiac output, you need to replace this valve. So ideally the physician, the surgeon does what? It replaces it with some prosthetic valve, that is something artificial valve is been placed. So what happens is that our body identifies it as an artificial and then tries to, that is what is happening. There is within the circulation direct injury to the erythrocyte within the circulation, commonly seen whenever we have something which is outside coming in, it tries to destroy the RBCs. Okay, because it's considering as a foreign object. Okay, so hopes you understood when there can be destruction of RBCs, commonly some problem in the erythrocyte, some problem in the plasma, or it can be some problem when there is direct injury to the RBCs, whenever there is something foreign body coming into the foreign thing which is present in our body and it is acting against it. Okay. Next is the last classification is bleeding. Okay, commonly seen hemorrhage resulting from RBC loss. So first what we saw is that RBCs were not produced properly, okay, which can be any reasons. Okay, The second thing what we saw is RBCs are produced, but they are being destroyed. Okay, that's the destruction of RBCs. And third reason is RBCs are nicely produced, they are not been destroyed, but there is a blood loss. Okay, the RBCs are lost from the body. There can be many reasons, most commonly road traffic accidents, or during surgery there is too much bleeding in the patient, or the patient is suffering with some bleeding disorders, okay, or he's having some, this is thrombocytopenia, where the chances is there more for the person to bleed. Okay, so at that time we'll see there is a loss of RBCs from the body. Okay, so bleeding resulting from RBC loss, bleeding from GI tract can be there, or epistaxis, that is nose bleeding is there, any trauma, road traffic accidents, bleeding from genitourinary tract, that is too much menorrhagia, that is heavy menstrual bleeding is there in the patient. That are the chances that there is loss of RBCs. Understood? Hopes you understood the three main classification of anemia and what are the factors which can cause this problem in your patient. Okay. Next is the clinical manifestation. So here I have not brought separate pathophysiology, but ultimately because we will be seeing the different types. So here the main thing is because of the less RBCs, what is causing is hemoglobin will be less, so less amount of oxygen. I'm talking about the pathophysiology in general. So less amount of oxygen reaching to the tissues, and which can cause further there's no adequate tissue perfusion can be there, mainly because there's no adequate oxygen there to perfuse that particular tissue. And then clinical manifestation can be seen in the patient. And clinical manifestation here I've brought in general clinical manifestation which can be there for an anemic patient. A person who has become gradually means slowly he has developed anemia with hemoglobin level between 9 to 11, that is lower than 12.5. So 9 to 11 gram per DL usually has fever, that is very less or no symptoms other than slight tachycardia on exertion and possibly fatigue. Okay, he becomes very you can't see much of the manifestation in the patient, but he may feel very tired doing a little bit activity, and he may have palpitation, because what is happening is there is tachycardia in the patient. So whenever there is a tachycardia, you can feel your own heartbeats, that is called as palpitation. Okay, and commonly tachycardia can be seen on exertion, that is doing some activity, he may have tachycardia. Okay, so this is a very less symptoms which can be seen in a patient between 9 to 11. Sometimes patient may show severe signs and symptoms also, but that is below 9. Next is weakness, fatigue and general malaise is common for all the patient. And what is most important, we should never forget to write, a pallor of the skin and mucous membrane, commonly seen in conjunctiva and oral mucosa also. You will see pale color. Conjunctiva, here you are going to see the lower conjunctiva, you will see pale. Even your palms, if you see, the patient is pale enough. Okay, commonly seen this, even the face also you can see paleness, pale face will be there. It's not as if you see a pale face, that is literally you can understand there's a less amount of RBCs in the blood. Next is there can be chance he can develop jaundice, angular cheilitis, that is nothing but this ulceration of this corner of the mouth. They're angular because angle, it is at the angle, that's why. Okay, ulcerated corner of the mouth and brittle, ridged, concave nails. Okay, so your nails becomes concave. Cave means like a cave itself, it's like this. So if this is the finger, just consider it. So nails are always like this now, nicely convex, but here it will go like this, concave nails. Okay, may be present in patient with megaloblastic anemia. In megaloblastic, this is what different types of anemia. So megaloblastic anemia, we can have the patient suffering with this concave nails which are brittle, that is very easily it can break off. Okay, next is the tongue may be beefy red, very much reddish in color, the tongue can be, and sore in megaloblastic anemia, or smooth and red in iron deficiency anemia. So you can see that yes, because of lack of this RBCs, your tongue is becoming red. There is a beefy red, and there here we are having a smooth, okay, smooth red. Now here is sore. Sore means he may feel little bit of pain also. Patient with iron deficiency anemia may infrequently crave, okay, there's a craving inside in the patient for ice, okay. When it's an iron deficiency anemia, patient, there is an iron, he's not taking adequate amount of iron in the food, or maybe he is not adequately eating different fruits, okay. So iron whenever this is there, he is having a craving. I've seen people craving not for the ice, starch or dirt, but I've seen craving for this chalks. You've seen chalks which we write on the board. Sometimes they crave for that also, okay. They like to eat it, because in iron deficiency anemia this is commonly seen. So we call it as pica, okay, we call it as pica. This is nothing but the clinical manifestation which a person is showing when he's suffering with iron deficiency anemia, that is craving for some of these things, that is dirt can be there, or it can be some starch or ice, okay, and it is called as pica. Restless leg syndrome is common in as many as 24% of those with iron deficiency anemia. Restless leg syndrome is nothing but may have pain, okay, pain or tingling sensations which can be there, okay. Next is cardiac status should be carefully assessed. When the hemoglobin level is low, the heart attempts to compensate. Now ideally our whole body is very smart enough. Whenever there is some problem, they know what needs to be done in order to cope up with it. So as our body understands there is a less amount of hemoglobin, so what it thinks that let me do something on the heart, okay, what I will be doing, what they will be doing, they will be increasing the heart rate. That's why the patient gets tachycardia with slight exertion also, okay. So whenever hemoglobin is less, the heart attempts to compensate for it. How it is compensating? By pumping faster, okay, and harder in an effort to deliver more blood to hypoxic tissue. Because what is happening when there's a less hemoglobin, less amount of oxygen will be reaching to the organ. So what heart is thinking that, array, it is not getting adequate amount of blood, so let me pump harder and let me pump faster. So pump harder means increasing the force of contraction, and faster means to cause increase in the heart rate. This increased cardiac workload can result in such symptoms such as the commonly tachycardia is seen. Palpitation is what your patient is going to feel, because he can feel his own heart beating fast. So that is palpitation. The palpitation is a symptom. Tachycardia is a sign which you can observe in the patient, even in the cardiac monitor, or you can just check his radial pulse or any of the pulse. Next is dyspnea. Patient may have shortness of breath because there won't be adequate oxygen being supplied to the respiratory system. Next is he may be having dizziness, okay, because there is lack of oxygen reaching to your brain. Orthopnea, that is when he is changing his position, he may have shortness of breath. And exertional means with some activity the person can have shortness of breath, that is called as exertional dyspnea. Because what happens is that when you do some activity, there is workload increased on the heart, right? In order to cope up with it, it tries to beat faster, it tries to pump faster. So what happens is that there is in the blood there is no RBCs. How they are going to give more amount of oxygen? So that time the person has the shortness of breath. Heart failure may eventually develop, okay. So it's one of the complication, you can say, one of the complication of anemia. A patient can develop heart failure as evidenced by enlarged heart, that is cardiomegaly, can be seen in a chest x-ray. When you see the chest x-ray, you can nicely see the patient's heart which is enlarged, okay. And liver, that is hepatomegaly, and by peripheral edema will depend upon which heart failure the person can develop. He can develop left-sided failure, he can develop right-sided failure. In left-sided failure, commonly we see the clinical manifestation which are related to pulmonary and the heart. That is that's heart failure of left side. Pulmonary congestion is seen, and because of that we can have this clinical manifestation of crackles can be heard on auscultation, and there can be clinical manifestation of dyspnea, exertional dyspnea can be there. And very important, the second important thing is there will be lack of cardiac output. When there's a lack of cardiac output, again it is going to cause hypotension in the patient. There won't be adequate blood supply to the organs. Next is right-sided. If right-sided failure develops, then you can see systemic congestion. Systemic congestion means what? You can see nicely this jugular venous distension can be there, hepatomegaly can be there, ascites can also be there in patient, and peripheral edema is seen. Okay. Next is nausea, vomiting with specific questions about the appearance of any emesis. Looks like coffee ground, melena. Melena is nothing but dark stools, diarrhea, anorexia and glossitis can be present. This is nothing but GI related problems which we can see in the patient. He may have the feeling of vomiting, which is nothing but nausea. There can be vomiting present. If he is vomiting, then you need to ask him how is the color of the vomitus or the emesis which is coming. Okay, so here we can see it is coffee ground. What you mean by coffee ground is, that is, you have seen coffee beans, how it is, like there will be darkish color, the emesis which is there, the vomitus which is throwing out, that is little coffee ground, means there is little bit of blood which was present for a longer period of time, and then that color is coffee brown, coffee ground as such. Now if it is a fresh blood because of some injury into the esophagus and all, it will be bright red color. Okay, but this is where there is for a longer period of time, there is a blood which is present and that is coming out, that will be coffee ground in color. Next is melena, that is nothing but there is blood in the stool, that time we call it as melena. Next is diarrhea can be there, anorexia, doesn't feel like eating anything. Glossitis is also common, that is nothing but inflammation of the tongue. Women in menstrual period may complain of excessive menstrual flow, because now here in this case it will be mainly because the patient is bleeding more. Okay, and that's why there's a loss of RBCs in the from the body, and then he can be suffering with anemia. So we need to ask for this in our patient, and any other vaginal bleeding can be there in the patient, needs to be further asked for. Okay, this is an overall clinical manifestation which can be there in our patient with anemia. Never forget to write about fatigue, malaise which can be there. Then pallor can be pale can be seen in conjunctiva, it can be seen on your palms, it can be seen on the face also. Okay. Next is neurological examination in pernicious. Okay, we will be studying about this. Typically for this pernicious anemia, we need to go for neurological assessment because it affects the central and the peripheral nervous system. So what can be there is presence and extent of peripheral numbness. Okay, the person can have numbness, paresthesia, that is you can't feel much of this, sensation is reduced. Then ataxia, poor coordination and confusion can be present in the patient. Okay, these are the problems which are related to pernicious anemia. Next is the diagnostic finding. Hopes you understood in all what all clinical manifestation you can write if overall anemia is asked for you. Next is diagnostic finding in an initial evaluation. So what we need to do is CBC, complete blood count, which help us to know what is the hemoglobin, how much is the RBCs in our patient, right? So hemoglobin, hematocrit, reticulocyte count, RBCs, indices, particularly the mean corpuscular volume and the red cell distribution width are especially very useful in identifying anemic patient. And then as we know, there are different factors which are there, different types also which are there. So we need to know whether the patient is having adequate iron or not, whether he is having adequate vitamin B12 or not. So that for that purpose we need to go for such other studies. So in iron studies we have serum iron levels, total iron binding capacities, percent saturation and ferritin is commonly done, as well as we have to go for serum vitamin B12 and folate levels are commonly obtained for this patient. So we have the CBC, haptoglobin and erythropoietin levels. Also bilirubin levels can be also checked. If you remember, we had seen about destruction of this particular RBCs when are there. What happens is that hemoglobin gets converted into bilirubin. So bilirubin, if it is high, that also can give us a sign that the patient may be having this anemia because of destruction or we say hemolytic anemia or destruction of RBCs. Next is the complication. As we have seen that in the clinical manifestation also, that the patient can go in heart failure. So we have to be very vigilant enough in order to identify that the patient should never develop, but if he develops, in the clinical manifestation I've already discussed with you, the left-sided and the right-sided failure needs to be observed for. Next is the person can have angina, that is nothing but the chest pain can be there, paresthesia, confusion and depressed mood. So the common clinical complications which are seen, because the person is totally fatigued, doesn't feel like doing anything, that's why the depressed mood can be there in the patient. Paresthesia and confusion can be specific to pernicious anemia, which is commonly affecting your central and peripheral nervous system. Next is the management. How can we manage anemia? Management of anemia is directed towards correcting or controlling the cause of anemia. If anemia is severe, the erythrocytes that are lost or destroyed may be replaced with a transfusion. Commonly, whenever there is a severe blood loss or during surgeries also, what the physician does, he always keeps this particular, by seeing his blood group, this RH factor and everything, the blood is been reserved for the patient, so that we can then transfuse if required during surgery or after surgery also. Okay, so transfusion of the packed red blood cells commonly given for the patient. Okay, so in management I've got short, but here is also very important that if he's suffering with iron deficiency anemia, then iron needs to be given. Vitamin B12 deficiency, then vitamin B12 has to be given, depending upon the different types which anemia the person is suffering with. Okay, so now we are going to talk about the nursing management, which is in total for anemia. The first thing is the assessment. So what we are going to assess for? We are going to assess for the clinical manifestation which we had seen. So you are going to assess for the paleness which is there in the patient, whether the person is getting fatigue, whether he is having any shortness of breath during exertion or during sitting only he has shortness of breath, needs to be assessed for, whether he has been started developing any clinical manifestation related to heart failure. Okay, all these things needs to be assessed, and any history. Okay, any history of previous surgeries and all, because, or recent surgeries which are done for the patient, because that can be a reason that there was a severe blood loss and no further adequate RBCs were transfused to the patient. Some reason can be there, what medications he is taking, all this detail needs to be recorded. Okay, next is the nursing diagnosis. Fatigue. So first problem for us is fatigue in the patient. So fatigue related to decreased hemoglobin and diminished oxygen carrying capacity of the blood. Here our blood is nothing but our RBCs. Okay, so imbalanced nutrition less than body requirement, because if he had adequate amount of nutrients which are there, that is the factors which we are talking about, he is taking adequate amount of iron, then he won't have suffered with anemia. So here that's why it is less than body requirement, related to inadequate intake of the essential nutrients. Okay, activity intolerance can be there, related to inadequate hemoglobin and hematocrit, and the last is non-compliance with the prescribed therapy. Now, what do you mean by non-compliance? Here, for example, if a person is suffering with iron deficiency anemia, we need to give this medication for more than 3 months. Okay, sometimes we give 1.5 months, 3 months, so continuous. So when the person is taking such medication, he feels no, after 1 month I'm all right, I don't have to take it. So this is called as non-compliance. People don't adhere to the drug therapy which is given to them. So it's very important that we teach the patient that if you want to get all right, you have to complete this course. Okay, this is an example which I'm giving. So it's very important that we educate our patient to follow the drug therapy properly. Okay, so that we prevent them from going from non-compliance. Clear enough? So let us see the interventions one by one. First is managing the fatigue. How can we manage the fatigue? First is assess the the level of fatigue in the patient because of some activity. Like if he says that I'm just sitting and walking a few distance, I feel fatigue, then it's very important that you need to give complete rest to the patient, because our heart is not able to cope up with even that activity because there is less amount of RBCs in the blood. Okay. So first is assess, and then assist the patient to prioritize activities and establish a balance between activity and rest that is acceptable to the patient. So So first is we should tell him that what is your priority, okay, what is your priority activity that you do first, and then always take adequate rest, because continuous activity is going to affect him. So few maybe 15 minutes, 20 minutes you're doing something, then see to it that at least 15 minutes you rest, if depending upon how much the person is anemic, okay. Patient with chronic anemia need to maintain some physical activity and exercise to prevent the deconditioning that results from inactivity. Now first is I want to explain you why in chronic anemic patient there is inactivity. Why? Because since they know that they do some activity, they get this shortness of breath, they feel totally fatigued, okay, they feel totally tired, so they avoid doing physical activity, okay. So that is what deconditioning effect, because they feel if I do something I am going to get weak, I will feel tired, so I don't want to do it. So it's very important that we teach them you have to start doing activities, okay. It's not that you should just sit and rest. With the medication which is going on, along with that, please start doing some physical activities. You know, it's very much required that per week at least 30 minutes a brisk walking or any aerobic exercises can be done by the patient, but depending upon how much is the hemoglobin. Next is assess for the other condition that can exacerbate, that is further increase fatigue in the patient, such as any pain present in the patient, depression and sleep disturbances. Commonly depression can be there because the client or our patient feels very much tired and he feels that he can't do much of the activity, that causes depression in our patients. So very important, we need to motivate them. Yeah, very good, you have done for 10 minutes, 15 minutes little activity. How are you feeling now? Little better? Because you know this mood problem which he is having is mainly because he is not maintaining adequate physical activity also. Yeah, I know there is RBC problem, but the second reason is because he is not maintaining adequate activity. So we have to encourage our patient to perform activity, and once he has been starting, the patient is just starting with this some exercise routine, tell him to start with lesser time, 10 minutes, 15 minutes, and then slowly increase it instead of not doing it at all, okay. So better that he starts with something with a lesser time and then slowly increases, and then he can follow it every day, okay, or at least 5 days a week, okay. Next intervention we'll be seeing about maintaining adequate nutrition. This is the intervention for imbalanced nutrition. So dietary education session should be individualized. So before dietary education, we need to first assess the knowledge of our patient related to different different fruits or different vegetable, different diet which has to be followed, okay. What knowledge he is having, what he thinks that how he can be treated with anemia. If he is suffering with iron deficiency, so let me ask what he thinks food rich in iron, okay, so that we know the knowledge of our patient. Then you start educating your patient, and very important, what is written is individualized. What do I mean individualized? You can't give a group health education. Here you need to sit with your patient and also include their family members and then talk to your patient. That is individualized. Involve family members, include cultural aspect related to food preferences and food preparation. A healthy diet should be encouraged. So here whenever you're teaching these, it's been said that you should think about the cultural aspects of your patient and their family, because if a patient is a vegetarian, so you can't tell them that please go and eat non-veg only, so this is not right. So you have to give him options related to vegetarian foodstuffs only, okay, and always guide the person to take more amount of healthy diet, okay, and avoid junk foods. The nurse should inform the patient that alcohol interferes with the utilization of essential nutrients and advise moderation. So now here the word is written as moderation. Why? Because if he is taking such iron supplements or something like that, so some other supplements, what happens if he is taking alcohol also, then the absorption of these nutrients are affected. So if he is taking for a longer period of time, it's very difficult for you to tell him to quit. We have we may tell the person to quit as much as possible, but if he is a chronic alcoholic, then it's very difficult. You can tell him to reduce. That's why the first is moderation, that is reduction of the amount of alcohol what is drinking, and then if possible quitting will be the best thing. Okay. Dietary supplements may be prescribed by the physician, that is vitamins, iron, folate, protein. Very important is that whenever a patient is taking an iron supplement, you need to guide him that his stool which he is going to pass will be little black in color, because this is because of this further removal of the extra iron which is coming. Okay, so the stool will be in black in color, not to get worried why his stool has become black. Okay, this is only because he is taking this supplement. Next is activity intolerance. As we have seen activity intolerance as a nursing diagnosis, what is the intervention? Assess the activity level, administer blood transfusion or IV fluids based on the symptoms and laboratory tests. Now, if it is severe anemia, then we have to give him blood transfusion. Packed red blood cells needs to be given to the patient. You have to, as a nurse, follow the pre-procedure and post-procedure and during procedure, all those criterias, that is, you check that this blood group is matching with your patient, and during procedure you need to see that you are recording in the first 5 minutes, 15 minutes of vital signs properly, because there can be chance of allergic reaction. And post-procedure you have to again see for any complications which can be there, which can be a delay hemolytic reaction which can be there in the patient. So very vigilant whenever the patient is getting a blood transfusion. Supplement oxygen may be necessary if the patient is having more amount of or less amount of saturation, then it can be provided. Nurse monitors the patient's vital signs, pulse oximeter reading closely. That's what I said, that you have to monitor the vital signs properly, so that you should not go in tachycardia. Then very important is that his saturation should be more than 95%. Other medications such as antihypertensive agent may be need to be adjusted or withheld in this patient. So depending upon what the patient is having further problem, sometimes we can also withhold antihypertensive drugs in the patient, because some of the antihypertensive drugs, what it does, it helps in loss of fluid from the body. So we don't want that further fluid is lost and he become fatigued enough. So that this decision will be taken by the physician as such. Okay. Next is promoting adherence with the prescribed therapy. As we have seen, the diagnosis non-compliance. So whenever there is non-compliance, what we need to do is to enhance adherence. The nurse assists the patient to develop ways to incorporate therapeutic plan into everyday activity, rather than merely giving the patient a list of instruction. What you mean by this is that instead of just telling that you have to take this medicine, you have to do this, better everyday plan you can give. Better with the menu plan also, it will be effective. Okay, what diet he has to follow. This is the medication which you need to take in the morning, maybe after food. So that is what you are writing in detail and giving, not just giving an instruction or list of instruction. For example, many patients have difficulty taking iron supplement because of the related GI effect, because it causes GI disturbances. So many patient feels like whenever I take this medicine, I have this GI disturbances. So it's better that we teach the patient that you take during meal itself. So what happens is will be less GI disturbance, because people do what, I am not feeling good after taking this medicine, I will stop it. No, you have to teach them not to stop the medication. What all problem you are having, let us know, so that we can help you. Educate patient about the serious consequences of abruptly, that is suddenly stopping some medication, as in the case of high dose corticosteroids to manage hemolytic anemia. In hemolytic anemia, that is the breakdown of RBCs which we had seen commonly. So commonly we give corticosteroid for the patient. So steroids cannot be stopped abruptly. Always we give a particular dose and then reduce the dose and reduce the time period also when it is given. It cannot be stopped abruptly. Okay, it's very important information you need to give it to your patient. So we have seen about the nursing management, right? So anemia, what is nothing but, it is nothing but there is a less amount of hemoglobin in the patient, and it is also causing there is nothing but there's decreased RBCs which is patient present in our patient. Okay, so we have seen the clinical manifestation, then management, and the nursing management. Thank you.